Fitz of North Edmonton Chiropractic Clinic in Edmonton, Alberta, Canada. I'm here with Colin, and I'm just going to show cervical traction, one of the adjunctive therapies that we do after manipulation. I use this on most motor vehicle accidents and anyone who has spondylosis or early stage arthritis or degeneration in their neck. It actually helps pull each vertebrae apart and stretches tight or hypertonic muscles. I also know from experience that if I do this too early in their therapy, especially after a car accident, that they're going to be way too sore and never want to do it again. So we only do this after they've had some manipulation and some recovery already, and they're ready for another stage or another level of improvement. So I'm just going to demonstrate how it's done, and then we're going to show you how it's the first method that we do. That's a little easier and not as aggressive. But this is just a cervical harness that we put under the chin. One of the times I'm not allowed to do this is if the person has TMJ or jaw complaint problems, because it puts too much pressure on the jaw. So we have regular weight for an average male or female is about 12 pounds. And it's over a head pulley system with 12-pound weight. And Colin, can you breathe or chew? You feel choking at all?
Not at all.
You're comfortable?
Absolutely.
Yeah. We're going to leave you here for 10 minutes, and then we'll come back and see how you're doing.
Wonderful.
All right? Thanks.